another one interview with nurses outside of the box. And today I'm so excited to actually talk to Caitlin Brady. Caitlin Brady is a phenomenal pediatric nurse practitioner, and I'm so excited to hear her story about how she actually went to actually do this, to be a pediatric nurse practitioner, which I think is really cool. So Caitlin, very welcome to the call here with Nurse Outside of the Box.
Thank you so much. Thanks for having me. Yes, I'm a pediatric nurse practitioner. I've been one for about 3 years now. And I was, prior to that, was a registered nurse for 5 years. So I can definitely talk a little bit about my journey. I work for Children's Hospital in Washington, D.C. in a department called Physical Medicine and Rehabilitation. And essentially what that means is we are sort of the medical team behind physical therapy, occupational therapy, development, and sort of we deal with any type of function. So what's very important to us and what our treatment goals often include are things to make children living with disease, chronic disease specifically, more functional. So it's a really, really fun field to be in because I think it really forces the provider to be innovative and creative, think about what's important to the patient. Sometimes we get so caught up in diagnosis and genetics and things like that, but really if any of us couldn't walk or couldn't give ourselves a shower by ourselves, the things that would be important to us would be doing those things. So my job is to work with kids and their families to make them more functional. So like I said, it's really exciting. I'm really passionate about it, and I'm sure you can tell, but I really have loved it. So yeah, that's sort of what I do.
I'm curious because I mean, you have such a passion right now. I mean, I can sense it like from the get-go, like your passion around it is phenomenal. I'm really curious about how did that journey start with you? You were a registered nurse for 5 years, right? Was that in pediatrics? How did you get this passion to actually go into being a nurse practitioner specifically? Love to hear that.
So I was in the rehabilitation field. I worked in a hospital that is known as inpatient rehabilitation. So what that means is sometimes, unfortunately, in the world, we hear about people who were functioning like a typical person, and then they're in a car accident or something horrible happens to them and they have a spinal cord injury or a brain injury, to list some of the many things that could happen. So once you're sort of stabilized medically, then you're transferred to an inpatient rehabilitation facility to learn how to live your life again and to move on. And that's the setting that I worked in from a pediatric standpoint. So after nursing school, I graduated, I moved to Washington, D.C. I got this job working with adults with brain injury, and I did that for about 6 months, but I've always sort of known that pediatrics is my home. That's where my heart is. Although I really do enjoy also working with adults, but the pediatric world sort of pulled me in. After about 6 months, they had an opening on their unit. And I was touched by so many of my patients and their stories, and not only that, but their families and their caregivers. And there's just something really magical to me about working with a family and a child through what is arguably one of the most difficult times in their life, and seeing kids come in who were told they were never going to walk again, walk out the door. So it really, really inspired me and really got me thinking as a nurse, what can I do to contribute to this field even further? And I have to admit, in nursing, we're so lucky because we are one of the, I think, few careers in the world where we can sort of make anything work, make any type of position work. And so I did spend a lot of time thinking about where could I be most useful? And ultimately, I love the clinical side of things, and I love caring for patients. So that's sort of what pushed me towards the direction of a nurse practitioner. Now, I will say, for all the nurses out there, I had several family members or friends ask me, well, why not just go to medical school? Why not become a doctor? Our favorite question, right? But really what my response is, and what I wholeheartedly believe, is that nurses, the training that nurses go through and the holistic model of care that we learn and really live by brings such a unique view and perspective to the care of patients. And even in, I work with wonderful physicians. I love the group that I work with. I'm inspired by them daily. But you can sometimes tease out that difference in training, and not to say one is better versus the other, but that's something that I think a lot of people who aren't in the medical field don't really understand, is that nursing, you kind of think of this whole person. You kind of really are trained to sort of think of it that way. And to, as a nurse, we're at the bedside, and you never really lose that training, even as a nurse practitioner. And I often catch myself bringing those sort of bedside skills to my visits, which, for better or for worse, but really it's such a unique role. And I think I've really seen that the more I've sort of lived in this role. So that's sort of what drove me. I'd say from a decision standpoint, really the need and want to continue to be clinical and sort of involved in daily care is what pushed me in the direction of a nurse practitioner.
I love it. I love it. So beautiful. I love how you're saying, yes, that doesn't make a difference. I'm curious, as you're looking towards nurses who ultimately maybe want to do what you're doing, right? Because that's all about nurse outside the box, all about finding those innovative ways that we can practice as nurses. Would love to see, what would you say to them? And I don't know if you want to kind of weave into that maybe an example, without of course having problems with privacy, right? But an example of what is it about your day or maybe a patient that you really, that's what made a difference for you. And that's when, like, this is why I do what I do, right? Really, with, I don't know if you can share that.
Sure. Well, one of my main roles is in our department, we sort of wear several different hats. And what I mean by that is we see and cover a lot of different populations. So whether you are covering patients who have had spinal cord injuries, or a baby who's been in the NICU very early in their life and has had developmental issues, we serve multiple populations in our department. But one of the biggest hats that I wear is working with the neuromuscular population. So children who are diagnosed with diseases such as Duchenne muscular dystrophy, Becker's muscular dystrophy, and spinal muscular atrophy. And that is really where I found my home as a nurse practitioner. And what has been really cool and exciting is we, in conjunction with the physical and occupational therapists that I work with, we have sort of started this program that has never been done before in this population, where we admit them for inpatient rehab in the setting of new treatments that are available to this population, and get them more functional. And we've presented twice internationally now on our program, and we've been able to work and connect with people throughout the world, really, to make this go, because the treatment for these diseases are all brand new. It was very much a progressive palliative type of diagnosis prior to 2016. And so I've really been blessed with certainly the chief of my division and the rest of our neuromuscular team to have the space to be creative and innovative and bring to the table, like, how can we help these patients on a day-to-day basis? And I feel very honored that I sort of was in the right place at the right time when treatment started, and very lucky to work with particularly the two therapists that I work with. They are unbelievable, and the patients and their families. And just, a quick example, just to give you an example of how the program works, when we first started, we had a 16-year-old young man come in who, his brother was going to college, and his brother would pick him up and move him from the couch to his bed to his wheelchair. And the family was distraught because they said, how are we gonna do this? How are we gonna lift him up? We can't carry him, his brother's gonna be away. Should his brother not go? And we were all like, no, let the brother go. Let him go to college. And we admitted him to our program. And I'm really, really proud to say that in the fall, he is gonna be going to college himself, and he will be living independently without the use of an aid. We were able to get him strong enough to live his life independently. And so to be able to have conversations. Of course, medical diagnosis plays a huge role. So you're sort of using the science part of your brain, but you're also using your rehab and in some ways the nurse part of your brain to say, this is what your life looks like on a daily basis. How do we make that better? And how do we make it more worthwhile to you? And that's sort of what this program has started. And so that has been a huge driver for me, because it pretty much, I want to say I was in my job for 6 months before we really started talking about this and said, hey, we've got something here, let's start it. But as an NP, you know, that is something that anybody could do. It's not, you know, there's nothing special about me that I could, you know, start this. Any nurse who sees a need in their patient or their population, you can make a difference. You can make a real difference. And that, you know, we see that all the time with registered nurses too, who innovate and sort of think of new technologies or devices at the bedside. But I'm here to say and encourage other nurses, like, if you have an idea, you need to go with it. You need to think it through. You need to weigh the pros and cons, weigh the stakeholders, and push it through, because if it's going to help someone, it's worth it.
I love that. Thanks so much for being on this call. Let's end with that. It is worth it. I mean, your passion speaks so much through right now. Yeah, let's make a difference, right? You're making a difference. If anybody wants to get in touch with you, how can they get in touch with you? Is it on LinkedIn? What's the best way to get in touch with you?
I would say the best way to get in touch with me is by email, because that's really what I check religiously. And it's my name, Caitlin, Caitlin, Brady, Brady, 438@gmail.com. And I'm happy to help other nurses or lend an ear or give advice. I mean, or learn from another person. I mean, that's the way the world goes around. And I think right now we're in a tough time in the world, but this is the time to be innovative. This is the time. And so I'm happy to work with anyone on anything. And thank you so much for having me.
Thank you, Caitlin. This was a phenomenal interview. We'll definitely post it. We'll definitely put your information. And yeah, let's go rock it as nurses, right? Because
yes, let's do it.
Okay, awesome. Thank you. We'll talk.
You're welcome.